Okay, this exercise is hip strategies, and it's a continuation of the ankle strategy, but we're leaning back, pivoting at the ankle, and we go too far, and our hips kind of tuck back. And I went even further that time, but you can see it's kind of like a quick response. So my effort is to regain my balance forward, and to do that, you can see my hips bend back and my hands raise up. In the other direction, going forward, I go too far, and it's the opposite. My hands raise up behind me. It's like a bow kind of a motion, but I'm trying to push my hips back. Boom. And then you can see it in the medial lateral directions. I'll get in a tandem stance here, and right there it is. So the side I'm trying to regain my balance to, I push my hips that way, and I raise my hand on that side. I'm going the other way, I push my hips that way, and I raise my hand to the side. So you can work hip strategies, both anterior, posterior, or medial lateral. Very important, very powerful movement to help regain our balance. And many times it's one of the missing strategies with patients. They still have ankle strategy, a little bit of stepping strategy. Certainly they reach and grab and hold on to things, but many times they've lost the use of a good hip strategy. So take the time, teach your patients how to do this exercise, go through it with them. They usually won't get it in the first or second pass, but stay patient with them and encourage them to kind of master this skill, because it really will help them prevent falls in the future. Thank you. Let's talk a little bit about balance recovery strategies. And two of these, really all three of them, can be used as exercises. The first is ankle strategy. So just imagine that you are rigid from the ankle to the shoulders, just kind of a straight line from your ankle to your shoulder, but the ankle could still pivot. So as we pivot back, you'll feel the toes kind of lift up off the ground. As we pivot forward, almost like a ski jumper, you'll feel the heels lift up off the ground. Ankle strategies in use are real subtle or small movements, kind of like a tree blowing in the wind, but they're, again, like that same example, they're happening all the time. So using them as an exercise is just to let that patient feel that change in pressure forward and back, and to see, do they have the motion, do they have the strength to be able to make those corrections around that ankle. Now, if we progress that ankle strategy and go a little bit further, whoa, you can see a hip strategy. So many times it's helpful just to work in one direction with the patient. In this case, I'm working posteriorly. But notice what's happening. As I lose my balance backwards, I push my hips forwards, but I also raise my hands forward, or raise them up to redistribute my weight forward. Raising the hands also slows down the loss of balance, how quickly I'm losing my balance backwards, and it gives me a chance to make a recovery movement at the hips. So contrast that with going forward past the ankle strategy, and you see me kind of try to push my hips back at the same time I'm raising my hands up and back. The hand movement might not be natural at first for patients because they're going to want to reach out in front of them, but if I reach out in front, I actually send my loss of balance further forward, and I don't help myself out at all. So that's ankle strategies, that's hip strategies. And if ankle and hip strategies aren't enough to keep your balance, I keep going backwards, then we start to take some steps, and that's called a stepping strategy. So if I lose my balance forward and the hips can't quite get the job done, then I take a couple of steps and step it on out. But take the time to go through and train your patients. What are these balance strategies? How do they work? Turn them into exercises. Emphasize ankle strategy, hip strategy, and stepping strategy. The last strategy we didn't include in that, and I'll show you from the side because it's easier to see, but think if you're in a canoe, you do this. And that's just called a knee strategy. Unless we get on something unstable, let's say like a rocker board, we don't tend to see knee strategies as much. I think maybe escalators too, in addition to docks, floating docks and boats and things like that. So thanks for tuning in, and don't forget to strategize to help your patients understand these different strategies. Thank you.